I'm here with Susan Stacey, a lactation consultant with Intermountain Medical Center. We're talking about the benefits of breastfeeding for new moms, and the benefits are humongous. But before we get to that, a lactation consultant, what is that? I benefited so much for my first child. They get you through the first few weeks.
Yes, so a lactation consultant has had additional training in regards to breastfeeding, and it's kind of a long process to get that. You have to have 1,000 hours of clinical experience. You have to do 90 hours of education directly related to breastfeeding, and then you have to take a 4-hour exam. So yeah,
And basically moms, when they have trouble with babies, they're not latching on, we call you.
Yes.
And that's what I had trouble with, and it can be sometimes the most frustrating, heartbreaking thing ever.
Oh yes, there's a lot of emotions involved with breastfeeding. You know, you want to do what's best for your baby. And so I really feel like a lot of my job is to act as a counselor and a cheerleader, you know, to help moms get through the hard times.
And before moms ever give up, we need to give them the information of the benefits. It's a no-brainer of both mom and baby.
Oh, absolutely. There are so many benefits. For babies alone, there's going to be 30% reduction in ear infections, 50% reduction, up to 72% reduction in respiratory infections. And those, the benefits of that increase over time. So they found that most of those health benefits for both mom and baby are conferred after about 4 to 6 months of breastfeeding. So the longer you can go, the more benefits you're going to see with it.
And you also mentioned the reduction of breast cancer?
Yes, absolutely. They've actually found that in women who breastfeed, there's about a 28 to 31% reduction in breast cancer in any age, and that's pre-menopausal and post-menopausal. So that's one huge factor. But they've also found that in baby girls who are breastfed, that as they grow into adulthood, it reduces their risk of getting breast cancer by 28%. I mean, how many things can you think of that you can ingest in your lifetime that's going to have that kind of lifelong influence on your health?
And a 50% reduction in SIDS, which is important. Just some basic, you know, convincing. It doesn't cost any money. Formula can be really expensive, and you get that intimacy with your baby and mom. You only get that once in a child's life.
Oh yes,
right?
Absolutely. Yeah, and there's so many things that, I mean, you know, if you were a baby, would you like to eat the same thing day after day? So with breastfeeding, a woman's milk changes over time to meet the needs and the demand of what the baby wants. And then also, every time you eat something, the flavor of that can go into the milk and give a whole new flavor, you know, sensation for your baby too.
Nothing like mommy's milk. Thank you so much, Susan Stacey, a lactation consultant.
Yes.